Hi, so let's get started. We're going to be talking about heart failure today. So, heart failure, also known as congestive heart failure, is a condition that develops when your heart doesn't pump enough blood for your body's needs. This can happen if your heart can't fill up with enough blood. It can also happen if your heart is too weak to pump properly. Now, looking at this, you can see there's two check marks there. So it can affect both the left and the right side of the heart and can happen suddenly or slowly over time. Most often, heart failure is caused by other conditions, which include coronary heart disease, heart inflammation, high blood pressure, cardiomyopathy, or an irregular heartbeat. Heart failure can also damage kidney, livers, and other organs. Other conditions it can lead to include pulmonary hypertension or other conditions like irregular heartbeats, heart valve disorders, and certain sudden cardiac arrest. There are certain risk factors that can increase your chance of having heart failure. Aging can weaken and stiffen your heart. People 65 years or older have a higher risk of heart failure. Other adults are also more likely to have other health conditions that can cause heart failure. Family history. Family history of heart failure makes your risk of heart failure higher. Genetics may also play a role. Certain changes or mutations to genes can make your heart tissues weaker or less flexible. Unhealthy lifestyle habits such as an unhealthy diet, smoking, using illegal drugs like cocaine, heroin, etc., heavy alcohol use, and lack of physical activity increases your risk of heart failure. Heart, lung, immunosuppressant conditions like HIV, COVID-19, they raise the risk. It's also true for long-term conditions like obesity, high blood pressure, diabetes, sleep apnea, chronic kidney disease, anemia, thyroid disease, or iron overload. Cancer treatments such as radiation and chemo can injure your heart and raise your risk as well. Atrial fibrillation is also a common type of irregular heartbeat, can cause heart failure. And last but not least, the last risk factor is that you have, if you are of the African American race, you are more likely to have heart failure than people of other races. Not exactly sure why. There's been no official evidence stating as the reason why, but it just is. Now, generally, when you have heart failure, you have fluid buildup in which blood backs up in the veins, causing fluid to build up in the lungs, ankles, feet, and legs. This is known as edema. You can have shortness of breath, in which fluid in the lungs can make it difficult to breathe. Swelling, in which fluid buildup causes swelling in the legs, ankles, and feet. Poor blood flow, in which when the body doesn't get enough blood, it doesn't get enough oxygen and nutrients, which cause the skin to appear blue or gray. Symptoms. There are two causes of heart failure, which we said before. Let's take a look. First, there's two types of heart failure. There's left side heart failure and right side heart failure. So left side heart failure causes include So left side heart failure is more common than right side heart failure. There are two types of left side heart failure based on how well your heart pumps. This measurement is called ejection fraction, like we're going to talk about in a little bit. But if you have reduced ejection fraction, the left side of your heart is weak and can't pump enough blood to the rest of your body, in which case you have chronic conditions that damage or weaken the heart muscles or the main cause of heart failure with reduced ejection fraction. For example, you have coronary artery disease or heart disease can prevent your muscle from getting enough oxygen. Other causes of this type of heart failure include faulty valves or irregular heartbeat. In heart failure with preserved ejection fraction, the left side of your heart is too stiff to fully relax between heartbeats. That means it's difficult. It can't fill up with enough blood to pump out your body. High blood pressure and other conditions that make your heart work harder are main causes of heart failure with preserved ejection fraction. Conditions that stiffen the heart, such as obesity and diabetes, also cause this type of heart failure. And over time, your heart muscle thickens to adapt, which makes it stiffer. Now, the right side heart failure, the main cause of right side heart failure is left side heart failure. In right side heart failure, your heart can't pump enough blood to your lungs to pick up oxygen. In left side heart failure is the main cause of right side heart failure, like we mentioned earlier. That's because left side heart failure can cause blood to build up on the left side of your heart. The buildup of blood raises the blood pressure in the vessels that carry blood from your heart to your lungs. This is called pulmonary hypertension, and it can make the right side of your heart work harder. Congenital heart defects or conditions that damage the right side of your heart, such as abnormal heart valves, can also lead to right side heart failure. And that same is true for conditions that damage the lungs, such as COPD, in which you can't breathe. Moving on to symptoms. So there's a variety of symptoms. Officially, there are no official symptoms, but you may start to feel tired, short of breath, notice fluid buildup in your lower body, around your stomach or your neck. And symptoms, they really change depending on which side of the heart is failing. Looking at this chart here, you get a rough idea. So left side, when you have left heart failure, most common, you get coughs, fatigue, which is like extreme tiredness even after rest, general weaknesses. You start to turn a little blue, you can't sleep, and you're just unable to lie down flat. When you have right side heart failure, you mostly get nausea, abdominal pain, edema. You have to urinate often, and surprisingly, you get a weight gain also. Again, these are not really full diagnoses. These are just kind of things we look at. Speaking of diagnosis, I don't know what happened to this slide here, but your provider may order. There's a couple ways to do a diagnosis. So your provider may order blood tests to check the levels of certain molecules, such as brain natriuretic peptides, which we call BNPs, and these levels are high during heart failure. These peptides are usually important in keeping your heart functioning normal, and when you're failing, these levels skyrocket up. And so they may do that, and they rise during heart failure. Second thing they may do is they do an echo scan. And when they do an echo scan, they look for one of two things. They look for your ejection fraction, which is something we mentioned before. It's how efficiently your blood is being pumped out. And if 40% or less of the blood is in your left ventricle, is pumped out in one beat, you have heart failure with reduced ejection fraction. And if there's 50% or more of the blood left in the ventricle after you pumped out, you have heart failure with preserved ejection fraction. So now we're going to just do a quick thing about management. So we have non-drug management. You want to decrease your sodium levels, your salt intake. Salt makes fluid buildup worse. You want to aim for a healthy weight, since extra weight can make your heart work harder. You want to get regular physical activity. You want to ask your healthcare provider about how active you should be. Your level of activity depends on how serious your heart failure is. Sometimes your provider may recommend rehab just to improve your factors. May improve your exercise status, reduce your risk factors. If you smoke, you want to quit smoking. Obviously, you don't want to make any lung issues specifically worse. They can also narrow the vessels a little more. We don't want that. You may be asked to quit alcohol as well. Again, depending on your situation, we always say quit the alcohol to better manage your condition. You want to decrease stress levels. So learning how to cope with stress levels, relaxation techniques, yoga, meditation, all of those are key. Another key way to reduce heart failure risk, to improve heart failure conditions, just reduce overall risk factors to any health conditions. And last but not least, improve sleep. Very few people appreciate the importance of a good sleep, and it's important that you understand that, because a good night's sleep is key to reducing and improving all conditions and reducing symptoms. Now, drug management. Drug management for heart failure is a little tricky. You start with something called, you have ACE inhibitors, you have ARBs, you have ARNIs, beta blockers, SGLT2s, aldosterone antagonists, and diuretics. Specifically in this order is the way we want to give management, with a little couple changes. So you'll notice that some of these drugs, you'll notice them by the ending of their names. So like angiotensin converting enzymes, they end in pril, lisinopril, captopril, etc. Angiotensin 2 receptor blockers, they end in sartans, losartans, candesartans, etc. ARNIs, those are combination products. That's Entresto, is the only one that's on the market, the only one that you need to know. Beta blockers, those are end in LOL. Funny, right? But we'll talk more about those. SGLT2 inhibitors, they're relatively new. They're not really meant to treat the heart failure. They're meant to just reduce risk. Aldosterone antagonists and diuretics are meant as fluid management. Primarily, they're meant to reduce fluid risk. Let's get started with each of these. So ACE inhibitors, how do they work? They block the production of something called angiotensin II in blood vessels. Angiotensin II is an enzyme that occurs in an enzyme or a hormone enzyme that's existing in blood vessels in the kidney, lungs, and blood vessels, etc. These are key because they constrict or open up based on how the blood flows. And you want to reduce this. You block the production of it. It decreases the blood pressure. Same with bradykinins. It increases an enzyme called bradykinin, which then lets more blood flow, which is what you need to reduce the blood pressure. Now, in heart failure specifically, they decrease mortality, so it keeps you alive more, decreases hospitalization, improves symptoms. And what it really does is that it decreases ventricular remodeling, increases norepinephrine release, causes vasoconstriction, it lets you have sodium and water retention, and and reduces blood pressure. And this is important because you want to get everything out when you have heart failure. You don't want your blood vessels constricted. You want your blood vessels open, which is going to let blood flow more. You want to get sodium and water out because remember, you want to limit sodium. So to do that, you need to have all these vessels open so things will come flowing out, and you want to reduce that blood pressure. And things you want to keep in mind with people like this is that you have daily weight, blood pressure, creatinine clearance, electrolytes. Basically, you want to watch weight, you want to watch your blood pressure, you want to watch your kidney function, and your electrolyte levels. Again, sodium management. Contraindications. So when you can't use this, if someone has angioedema or any type of renal failure, after having this, you shouldn't use it. If you have already low blood pressure, you can't use this. If you have a hardened artery in the kidney, no, you can't use this. And most but not least, potassium. 5.5. If you have potassium level higher than this, you shouldn't use this product. Again, these medications, they increase potassium levels because they cause the sodium and water to go out, which then causes potassium to be retained. So you don't want them if their potassium level is already high. Side effects, big thing you'll see. Angioedema, hyperkalemia. So you have rubber fluid buildup, high potassium. Specifically with ACEs, you have a cough. You know why? Why do you have a cough? Because of the bradykinins. So it's important to know that the coughs are caused by the bradykinin, low blood pressure, and last but not least, you have kidney problems. Moving on to ARBs. Now, these are a little different than the ACE inhibitors because they stop the binding of angiotensin II at the angiotensin II receptor. So instead of stopping the production, these stop the binding, which is different. There's a couple key things that happen because of this. Remember, it does not increase kinin protection. It does not increase kinin production. And what does that do? Kinin production is actually responsible for the cough side effect that we saw. And because it doesn't have any type of kinin production or kinin effect, it's not going to cause any type of cough as a side effect. Again, these you would use when patients cannot tolerate the ACE inhibitors and the previous ones. These are going to improve lifespan, decrease hospitalization, improve symptoms as well. And again, they have the same exact side effects as the ACE inhibitors, but except that there is no cough side effect. And they're not any better. You don't want to use both of them together, just because they are the exact same thing, technically speaking. ARNIs, I told you before now that this is mostly Entresto. The only one you need to know, it's a combination of a neprilysin inhibitor and an ARB. So neprilysin is an enzyme that breaks down natural substances in the body that open narrow arteries. Limiting the effect of neprilysin increases the effects of these substances and improves artery opening and blood flow, reduces sodium retention, and decreases strain on the heart. And there's one product out there which is Entresto, and that's the only one you really need to know for heart failure. So now that we mentioned that, we're going to move on to a little bit of a different story. So we have two common causes of death in heart failure patients. So we have either heart failure gets worse or they get an arrhythmia and die. And so ACE inhibitors, ARBs, and ARNIs that we just mentioned are going to be used to stop the progression of heart failure. Beta blockers, on the other hand, the ones that end in LOL, they're going to be used to prevent arrhythmias. So let's start with the beta blockers now. So the main purpose of the beta blockers is to control the heart rate and prevent them from spiraling. They work by inhibiting beta adrenergic receptors and blocking the effects of catecholamines in the heart and vasculature. They decrease arrhythmias, heart rates, and cause vasoconstriction. There are only 3 beta blockers that are used in heart failure due to their selectivity: bisoprolol, carvedilol, metoprolol, succinate, not tartrate, succinate. So keep in mind, and these 3 are shown specifically based on their selectivity. In heart failure specifically, it decreases mortality, decreases hospitalizations, and increases symptom improvement. So everything that we've talked about in terms of drugs right now have decreased mortality, so decreased risk of death, decreased risk of hospitalizations, and improved symptoms overall. And that's important to know. Okay, so contraindications for beta blockers, there's something called absolute and relative. If you have any of these, you don't want to use beta blockers at all. So if you have severe bradycardia, you don't want to use beta blockers. If you have second or third degree heart block, you can't use beta blockers. Any type of shock, beta blockers are wrong. Heart failure again, but it's not meant for this. If it's severe heart failure, you can use it, but if it's not, then it's fine. And if there's any type of airway problem, you can't use this because beta blockers will also beta blockers also work in the lungs a little bit. They control your breathing and your heart rate, so you don't want to use them if you're having breathing problems. And some side effects that you should worry about is fatigue, bradycardia, heart block, hypotension, low blood pressure. SGLT2 inhibitors, on the other hand, these things, sodium glucose cotransporter 2 enzymes, they improve blood glucose control and decrease body weight and blood pressure. These were developed to treat diabetes, but it has been found to help people with heart failure. There's a couple products out there. There's Jardiance, Farxiga, and Invokana. Those are the 3 that are out there. They're very expensive products, and usually they're pretty common now, standard. So like we said before, how this works is that it inhibits the sodium glucose cotransporter 2 in the kidneys, which then promotes urine excretion of sodium and glucose. And now you get a diuretic effect that can alleviate fluid overload. So again, now you're flushing things out. You're flushing out sodium. Remember, you want to lower the sodium levels. That's good. And the key aspects of these are that they're cardioprotective effects. They're good for the heart. They're good for the lung. They're good for diabetes. Those are the 2 things that these function for. They can be used in both reduced and preserved ejection fraction and heart failure. Aldosterone antagonists. Now we start to delve a little bit down. So these again, they block the effect of aldosterone, a hormone produced by the adrenal glands on the body's mineralocorticoid receptors. They reduce fluids in the bodies and they increase potassium levels. These, you see 2 drugs out there. You have spironolactone and you have eplerenone. And the only thing you have to monitor for these is potassium levels, because that's all they're main for. If you don't have another diuretic with these, then your potassium levels can go up. And last but not least, we have diuretics. Furosemide, which is Lasix, bumetanide, torsemide. Those are the diuretics. Hydrochlorothiazides, all of them. Mechanism action, what they do is you have decreased water. So they decrease body water. They have decreased preload, which is how much is in the lung, how much is in the ventricle, and you have decreased congestion. These things, they decrease pulmonary. You have decreased pulmonary congestion and edema. You have decreased daily symptoms. You have increased exercise tolerance. No benefit on mortality. Remember, it doesn't actually make you live longer or reduce risk of death from heart failure. All it does is increase the fluid output. Side effects that you need to worry about. You have decreased cardiac output, electrolyte depletion, and increase in creatinine clearance. So diuretics are the ones where it's important that you watch all electrolytes, not just sodium or potassium, but all of them. And with these, you want to monitor daily weight, blood pressure, kidney function, and electrolytes. Okay, so there are 2 types of diuretics. We have loop diuretics, which are your Lasix, furosemide, bumetanide, torsemide. Then you have your thiazide diuretics, which is hydrochlorothiazide, thiazide, chlorothalidone, all of those. So loop diuretics increase sodium excretion by 20 to 25%. Remember, you want to get sodium out, and that's the big thing with heart failure, and these loop diuretics do that the best. They have an excellent ability to move fluid, except that the absorption by mouth, the oral absorption, may be decreased if there's edema in the gut. Sealing effect is at maximal doses, so the highest dose you get is the highest you can do. You have more efficacy when you have reduced renal function. Thiazide diuretics, on the other hand, hydrochlorothiazide, chlorthalidone, they increase sodium excretion by only 10 to 15%. You have antihypertensive effects with them, so they're actually better for the blood pressure than the loops are. So if they have a blood pressure issue, you might want to try thiazides. They're rarely used as monotherapy. They're usually in combination with something else. And if you have reduced renal function, you actually lose effects of the thiazide a little bit. So you need to have a strong kidney in order to function it. Again, if you guys have any, that's it for heart failure. If you have any questions or concerns, please feel free to leave them in the comments, and also leave comments on if there's any other specific topic you guys want me to learn and do a video on. I am open to all ideas at this point. So thank you so much. Have a good day.